Birth defects in a newborn child. We know that in human beings, in our population, 3% of newborn babies will have some kind of birth defect, out of which about 1 to 2% will be major types and rest will be minor type of birth defects. So it is not totally preventable, but we should know something about what are the risk factors and how we can reduce chances of getting a defective baby during pregnancy. So there are a couple of tips that I would like to give. First thing is, anyone planning for a pregnancy, try to maintain or have a good lifestyle and maintain a good within limit weight. Quit smoking, drug abuse, and reduce alcohol use as much as possible. Good sleep, good diet. Second is, always plan a pre-pregnancy counseling. That is called prenatal counseling with your gynecologist. The doctor is going to check and talk to you about your family history, about your prior obstetric history, about your prior abortions, about your any diseases that you have, any chronic medications that you've been taking, your vaccination status, etc., and is going to advise you accordingly before planning your pregnancy. So this is an absolute must. The third tip is that one should take at least folic acid supplements for at least a period of 3 months before planning pregnancy. Fourth is, you should complete your vaccination status. Whatever vaccines are recommended by WHO for an adult woman, they should be completed, whether it is simple like COVID or it is like hepatitis A, B. But we know that some vaccines like rubella, if a pregnant woman develops rubella in the first 3 months, severely defective child can be born. So rubella is one vaccine which should be completed. And then one has to remember that most important thing is, once you are pregnant, then you must not take any medicine without any prescription from the doctor, even if it is from a simple disease or a simple problem like fever, cold, blocked nose. And certainly you should remember that even homeopathic, Ayurvedic and similar medications also are harmful. So do not take any medicines without consulting a doctor. In the early months of pregnancy, one should avoid exposure to any kind of radiations like X-ray. One should stop any medication that has been taken previously for diabetes, for blood pressure, for heart disease. Better would be if the woman consults the gynecologist before planning a pregnancy, so that whatever medication is safe in pregnancy, that can be started for her chronic illness, and only after that they should be planning pregnancy. So these are some tips that one should follow always when you're planning pregnancy.